we're going to let the panelists introduce themselves and we'll open it up for questions. Let's go ahead and start with David, and then we'll go to Zach and we'll continue from there.
Good morning, everyone. Happy Tuesday. It's so nice to be here for our second meeting. Um, and I'm from Integrity Senior Placement, and we're really love forums like this because we're all about empowering people with information about aging in place, aging gracefully. I know we've all heard that term. And we love to educate people on what all their options are regarding a living situation. And that includes staying at home. It could include, memory cares, assisted living, group homes, independent living, etc. And I think we all agree what we want for our seniors is a great quality of life. We want them to get the care that they need. And we also want them to be safe. And if it warrants it, maybe a margarita. And that's it.
Wonderful, David. Thank you so much for joining with us. We'll now go to Zach.
Yeah, good morning, everybody. June already. Whew. But yes, I'm a local home care owner and board member of the Arizona In-Home Care Association for Best Practices in Safe Delivery of Care. And echo David, that we're all here to support everyone. So thank you.
Awesome. Marlene, if you'd like to go.
Hi, excuse me, I'm Marlene Porter. I am an elder law attorney. I do a lot of estate planning as well, and I'm here today to talk about All-Tex eligibility and answer questions and give you any information that you may want to know. And I've been practicing law in Arizona 30 plus years, and I love it. So we're glad we've had a good spring, and I'm glad to join all of you. Thanks.
Awesome. Thank you. And now Lamar and then Trey.
Yeah, I'm Lamar Eccles. I'm a broker is what I am. I work with all the insurance companies, and trust me, I hate them as bad as you do. So, but any carrier pretty much I work with is how it goes. You'll see the board behind me says Vector ES. That's for employer solutions. So I have a very large group book. I do the benefits for lots of different businesses. In that arena, you have people that are aging into Medicare or going on disability and need Medicare. So I also have a very large Medicare book. So that's what I do all day, every day. I've been licensed since 2000. So it's been almost, 26 years now. So just here to help and answer questions. So.
Good morning, everybody. I'm Trey Klosser. I'm a physical therapist by trade. I have a specialty in geriatric care, so I can answer any questions in that realm. And I'm also the administrator for Advanced Home Health and Hospice of Arizona. So happy to be here and answer any questions regarding home health care or hospice care for the audience today.
Okay, thank you to all of our panelists. We're now going to open up for questions. Once again, there are two ways to ask questions. If you hover at the bottom of the bar, you'll see the raise hand feature. You can raise your hand and we'll know that you have a question and you can speak your question. If you would not like to speak, there's also the chat feature and you can type your chat and that question will also get answered. And it looks like we already have a hand raised. Colleen, if you'd love to ask your question.
Yes, I have a question for Lamar. And Lamar, I'm sure you've never heard this question before, but what are the factors that seniors should consider when deciding between Medicare Advantage and Medicare supplemental plans?
Yeah, that's a great question, and I don't even know if I know quite how to answer. And I'll say that because my father-in-law and my mother-in-law are obviously married, and one has an Advantage plan and one has a supplement, and they're both just as happy as can be. Okay. So the big thing I tell people is original Medicare's Part A and B. It's basically an 80-20 plan, right? So usually 20% of the costs are on you. So I tell people get out of original Medicare and either go into an Advantage plan or go into a supplement. I call the supplement kind of the Cadillac of the two because you can go to any doctor you want. And, if you get like a Plan G, you're looking at only out-of-pocket costs of around $215 or $250 a year max. Okay. So those are really nice. Advantage is just like you're used to with insurance as you work at your employer, right? You've got a network, you've got a deductible, you've got co-pays, and they're usually a lot less expensive than a supplement because you're only paying the Part B premium. which the Part B premium is typically around $200. It's $202. We've got some plans where you can buy down that Part B premium. So if costs are a big deal, then I tell you to get on an Advantage plan. If you're doing well, then those supplements are the way to go. So I don't know if that answers your question the way you want it, but that's the best way to describe it, I think.
Thank you very much. Appreciate that.
Wonderful. As people start thinking of questions and getting warmed up, we actually received some questions ahead of time. So I'm going to go ahead and send one of those in the chat. Someone asked, and I believe this is for David, walk us through the difference between independent living, assisted living, memory care. When does each one become the right call?
Oh, that's a really good question. Excuse me. So, what is going to drive as we age is going to be what our care needs are. And, then of course, finances come into play. So there's going to be an appropriateness for, an independent living, assisted living, memory care. That's really going to be based upon what your care needs are. So typically, what we will do is we will do a complete psychosocial assessment on an individual and to determine, what their options are, what are their best options. And I know in the last webinar, I talked a little bit about there's an appropriate time and place for a group home, a smaller home, and independent living, memory care. But certainly if someone is independent, all of we call them activities of daily living, bathing, dressing, eating, et cetera, definitely independent living is going to be appropriate. Assisted living is going to be, if people need assistance with their activities of daily living. And of course, memory care is going to be a diagnosis of a form of dementia, cognition deficits, et cetera. Now, that doesn't necessarily mean that, if a person has a diagnosis of a form of dementia, that doesn't mean they have to go to a memory care. All of these entities are determined by an assessment that is done by the facility. If it's a memory care, assisted living. So, when I used to work in assisted living, memory care, we had people that had a diagnosis of a form of dementia and they lived in assisted living. But again, that's going to be dependent upon the assessment. If someone, if I do an assessment on someone and let's say it's a husband and a wife, for example, and they both seem relatively, they're independent. However, let's say maybe one of them just was recently diagnosed with a form of dementia, then of course I would definitely recommend to the family, let's look at communities where they have a memory care, just in case down the road, so you don't have to move again. Typically, people do wait too long, because loss of independence is very hard as we age and when nobody wants to leave their home, et cetera. So, try to empower them with information about what to watch for and what to do. And definitely, even this past week, I've had a couple people who are living at home with a form of dementia, and there's all kinds of dangers with that, et cetera. But we do, typically, if you have your wits about you, typically you would be better to, at least go look at some places, and not wait until there's an emergency to make a move. But we typically, it really is going to be dependent on what your care needs are. But yeah, if you're independent and you want to get into a really nice community, you can get in there independent. And then what I like is the aging in place, which they also would have an assisted living. So if you do need care down the road, it's right there. So hopefully that answered that question.
Thanks so much, David. All right, this is a question for Trey. What is the actual difference between home health and hospice? I'm not sure what is the right fit.
Sure. Yeah, that's a great question. And our staff get that all the time. So the short answer is home health is a rehabilitative service and hospice is a palliative service. So home health care, the intention and the goal is to work with somebody who's had an injury or a setback from an illness or a disease and to get them better, to make an improvement in their condition. And ultimately, our goal is to discharge you to the next higher level of care. So that might be an outpatient facility or cardiac rehab. A lot of times we discharge our patients to. Hospice care is going to be if you want palliative care. So I usually the questions I ask or the indicators I look for is, do you want to go to the hospital again? Maybe you've been going to the hospital several times in a year and you don't really wish to go anymore or get any more treatments. That might be an indicator that you should look into hospice care. If a physician has told you that you have an illness where it's terminal and there's really no good treatment, you should be looking into hospice care. And the hospice team is going to manage the condition. They're not going to treat the condition or look for a cure, but they will, they'll manage the symptoms that you're experiencing so that you're not in pain or you're not short of breath or not having issues there. And essentially, we let the body take its natural course and keep that person comfortable so they can pass with dignity. So that would be the major differences there.
Thank you so much. We also have a question in the chat from Troy that reads, what conditions qualify for Medicare covered home health care? I believe Trey and Lamar could speak to that.
Yeah, so for Medicare to cover home health care, there's a lot of conditions. They have this big algorithm called PDGM. I won't go into the details. It would be very boring, but there's hundreds of conditions that Medicare might cover home health services for. So the big ones are, a recent hospitalization, maybe for a UTI or COPD, a heart condition, multiple falls, falls with an injury, maybe a hip fracture, or a shoulder injury from a fall. Another big one that we do is wound care. So wound care and you're not able to get out of the house and you need a nurse to come and do that wound care in the home. We do that quite a bit. And then catheter care is a big one too. If you need a catheter to be managed in home, you're not able to get to a urology office. Home health can manage that at home and Medicare will cover that. So those are some of the big ones, but there's hundreds of conditions really. And they have this algorithm that, we can check to see if the condition is covered, but those are the major ones that we see.
Wonderful. Thank you. I believe Troy has a follow-up question. Troy, you've raised your hand if you'd like to unmute.
Yeah, in regards to long-term care planning, are there any pros or cons to transferring assets to family members?
Marlene, would you like to, would that be kind of in your sector?
Yes, thank you. That is a good question. So when you're looking at future eligibility for Medicaid services, you're looking at a service that is really based on your ability to meet the financial criteria. And so when they're considering someone who has applied, they're going to look at assets. And one of the big ones that they look at is, have you given away or transferred assets without a value back to you? And they look back 60 months. And that gets to be a big stumbling block for people if they don't plan carefully, and if they don't categorize assets correctly. So when you're looking at what happens if you want to transfer assets, you should really get familiar with the rules, hire an attorney or someone else who knows the rules really well to go through with you to tell you what's permissible and not permissible. The Medicaid rules, I like to say, are kind of like the income tax rules. There's a jillion rules, but there's also 2 jillion exceptions to the rules. So if you learn and study or pay somebody to assist you with understanding the rules, you can come up with a plan if that is something that's being considered to do gifts, where you can plan for purposeful ineligibility for a while before you actually become eligible, and you can do that as long as you know what you're dealing with. But you wouldn't ever just go out if you're anticipating a loved one needing Medicaid services within the next 60 months, don't ever go out and just give away assets. That's going to cause a big problem coming down the road, and it can really delay eligibility qualification process, because they will go back and search 60 months to see what's happened. And you have to explain any kind of transfer. I don't know if that answers the question well enough, but you can follow up if you like.
Thank you so much, Marlene. I believe Tracy had her hand raised, but your hand has gone down now. Tracy, do you still have a question?
I do.
Please, go ahead.
Okay, thank you. I wanted to first ask, I guess Marlene or any of the other panelists could answer. In regards to, you're saying Medicaid, but I'm talking about all techs specifically. Is that what you're referencing?
Yes. So the Medicaid program is a federal program, and each state has their own set of rules that overlays the federal rules. And in Arizona, Medicaid is under the auspices of Alltex, which is Arizona Long-Term Care Services.
Okay, great. And with that, I know there's two-part qualifications, one being the financial, and then one is going to be the daily living and what they can and cannot do. Could you speak to one, the financial piece of that, and then I guess the second part as well, qualifying those individuals? My mom has Alzheimer's, dementia, and she does live in a mobile home that I own. We have a caregiver there with her. Room and board is covered, and then we pay her hourly. But it's getting to the point now where we all think mom is progressing and may need some additional help. I mean, she can't cook for herself. She doesn't know what day it is. All the things that come with that. I just wondered if you could speak a little to that.
Sure, I'll be happy to do that. So your mom's case is pretty typical of people that are aging in place and family is helping, and you're wanting to know what the benefits are and how you qualify, and you're correct. It's a true two-pronged test that you must pass before you're eligible for Alltex or Medicaid services. The first part of that is the health test, which is actually based on a lot of things that you've mentioned. So if your mom needs assisted living because no one is there that can care for her and she can't manage on her own, or maybe she has memory issues, or maybe if she was in a much worse case, she might need skilled nursing care. Those would be the kind of medical things that you look for. And Alltex does a screening. And sometimes that screening is thorough, but most times it's not. And it may take some assistance from people that are helping family members. If you have medical people that can help with that, it always helps to give them your input because sometimes they miss it, or sometimes when they're doing a medical screening, the ill person themselves might pretend to be very well, and the caseworker gets misled and doesn't see the things that are really going on. So just be aware of that. But they're looking for activities of daily living, like we've talked about. They're looking for cognitive impairments. They're looking for any kind of psychosocial deficit that someone has where they're going to need help. So that's the first and probably the most important test, because if you can't pass the medical test, you're not going on to the next phase, which is the financial test. And when you look at eligibility from a financial standpoint, they look at two primary things in the beginning. One is an income test, and the second is an asset test. And so there are income limits. Right now, if a person is single, this year the limit on their income to have automatic eligibility in that category is $2,982 a month of gross income. So it's possible if they have more to become eligible, but then you're looking at additional things. They might need what's called a Miller's trust or an income only trust, which is a legal manipulation kind of the rules to allow people with more income to become eligible. And then you're looking at the resource test. A single person has all applicants must only have $2,000 in assets, but there are exceptions to that. Some assets that they could have are, they might be able to have, they can have a home, they can have a car, they can have pre-need funeral plans. There are a few assets that are exceptions to the rules, but when it comes right down to available cash in your checking account, $2,000 is the limit. If you're married, it's a lot more lenient because they make allowances for the well spouse because they don't want to impoverish the well spouse. We could argue maybe that's not exactly what the rules allow right now, but they have changed the rules recently. And so a well spouse in that situation, even though the ill spouse can only have $2,000, the well spouse can have $162,000 in countable assets. So there are rules surrounding all of that as far as recategorizing assets or taking assets that would count against you and spending them on non-countable assets. So just know there are income limits and there are asset limits. And so when you're looking at that, when you said that you own the home that your mom is in, that's totally fine. She can live there. But if she owned it herself, she wouldn't have to sell it because she could have that could be her countable asset, depending on the equity in the home. So when the previous questioner asked about transferring assets, if your mom had let's say she has an investment account, she's got $150,000 in it, and she decides, well, I'm just going to transfer 100,000 or 130,000 of that to you, then the look back rules will apply and those things will need to be explained, and a transfer penalty will be applied, which will make her ineligible for Altex for a certain period of months, depending on the amount of her gift. So the rules are complex, but from what I'm hearing you, from what you told me, your mom probably could qualify. If she can qualify health-wise, it wouldn't be very long before she would qualify financially if she doesn't have, a lot of other assets.
That's helpful. I think she would qualify financially. If I'm allowed, could I ask another question? Okay, thank you. If she does qualify medically and financially, does Altex allow that payment or whatever they charge to go to in-home caregivers, or does she need to be put in a facility?
Well, Arizona's a really great state to qualify for Medicaid because we allow, unlike many other states, we allow for all levels of care as far as home care, assisted living, and also nursing home facility level. So basically, if their medical condition is such that they could be cared for at home, Altex will allow for home health care to come in. Now, there are limitations on the amount of care you can receive at home, the number of hours they'll pay for, but it is a possibility. And then assisted living is treated under the rules like home health care, essentially, but housing and medical care can be paid for. And then if someone is severe enough that they actually need to live in that acute care situation or long-term care, it's really designed, and other states will allow that, but Arizona certainly allows for living in a facility. So Arizona's pretty flexible as far as the condition, as long as you can meet the care needs, meet what they will pay for, and they have rules about that and what they allow. And they will also allow loved ones to become qualified as the in-home health care assistant, helping them with activities of daily living. So a lot of families find that that's a good solution, at least until conditions get worse, that a family member who may have already been helping can continue to help, but be paid an amount from the system to be the caregiver.
Right. And I think, as the gentleman earlier said, cognitive testing and the other kind of testings would determine what level mom would be at. And so once that's done, would she, let's say she was qualified for assisted living, does she have to live with someone in assisted living, or would she have her own room? Or how does that work? Who determines that?
Well, once a person is qualified, then they can work within the rules of the system to decide if they're at home. Then typically you're going to have an in-home health caregiver that will help there, or a family member that qualifies medically to do that. If they're in an assisted living facility where they're not under full-time care, then the rules, the All-Tex rules right now typically pay for someone to be in a care facility where they have probably not a private room, unless that's all that if that's all the facility has available. But they will find that they're normally in a situation where they might have a roommate. They have caregivers then provided by the facility. So there are all different kinds of situations. It just depends on the person, but there is quite a bit of flexibility in the plan.
Okay.
I don't know if that answers well enough. You can answer a follow-up if you like.
Yeah, I think so. I mean, I guess that would be hard for mom since she has been on her own. And then who determines once they're in a care facility, and say they're in assisted living, and then this disease progresses, as I'm seeing over the last year for sure. Who determines when mom would have to be moved into a memory level care versus just assisted?
So normally that's going to be determined by medical personnel, and they're going to assess every so often and determine if a higher level of care is needed. Then once they're already in the Medicaid program, the facilities will normally assist to help find something appropriate if they're not in an appropriate facility, or if it has different levels of care, they'll advance them to the next level of care. So it becomes part of the medical determination then. But once they're qualified for the All-Tex system, then they are going to be eligible for increased care all the time. It's just a matter of working with the facilities to find the proper place.
Okay, so she doesn't have to re-qualify. Once she's qualified, she's qualified within the system, and then that care can change. Okay, thank you. Thank you for answering all my questions.
Can I pop in, Grayson?
Oh, yeah.
Hey, Tracy, it's David.
Hi, David.
Hey, I wanted to piggyback. Marlene just gave some great information, but there are a couple things. So, if you get to the point where you're looking at some different options prior to going, typically, we always advise, let's look at a couple places that take All-Tex, et cetera. And there are some of them that will allow you to stay in a private room. Sometimes you have to pay a difference. There are a few communities out there that will once you get into All-Tex, like Marlene said, they do pay for a shared room, but sometimes you can get a private room. Just depends on the community. The other part I wanted to throw in is, prior to even going there, they're going to do a complete assessment on your mother. So, if we went out and looked at a couple places, next week or in a year or whenever, and you go, you know what, this is the place for my mom, et cetera, then they're going to do an assessment. They can come to your home and do the assessment. It'll be done by a nurse. and they will know exactly what her care needs are. And that assessment will determine what is her, by Arizona state regulation, the health department, what is her appropriate placement. Is that going to be memory care? Is it going to be assisted living? And there's a lot of different ingredients in that. It could be, is she exit seeking? Is there a paranoia? There's a lot of different things they'll do to determine that. But they will do the assessment prior to you even. So they might say, you know what, we think she would be okay with assisted living, and that's going to be up to them. The other part, every single person that's in an assisted living and a memory care by the state of Arizona, they all get what we call a care plan, a plan of care that is administered by a nurse. And that is a plan that will be, you will be a part of that as her daughter. And they will keep you informed on, what's going on. Is she sundowning extremely or whatever? And so if she were to be in an assisted living, definitely, I always say you have to picture the individual in an apartment by themselves with the call button. And a lot of times that can kind of answer the question. And then they will determine that, but they will work with you. And if they think that if she's in assisted living and she needs memory care, you will know that well in advance, believe me. So I just wanted to add that on to what Marlene said.
No, that's really good. And then, so it's all text that comes out to mom's house to do the assessment?
All techs will do it. Yes, they will. And definitely, like Marlene said, you definitely want people to be there with her, because I've had people that, they overcompensate, or they mask things, and, oh yes, I can do this, I can do that, etc. Right?
Oh yes.
So definitely. So the more ammo you have, so to speak, to get her qualified based on her activities of daily living. They have a point system, and you said she had an official diagnosis of a form of dementia. Is that correct?
That's correct.
Right. So all of those things help, right? So the more points you can get, so to speak, but definitely you'd want somebody there with her. And hopefully, like Marlene said, you'll get one of the good Altex people to come do the assessment. So
yes, my mom is very, she thinks she's doing everything great,
yes.
But she can't remember if she just took a bite of whatever. She doesn't even know what she had for breakfast, lunch, dinner, all of those things.
Right. And to go back, and the first question I had earlier regarding the memory care, definitely, it's going to be, is there an advanced, cognitive decline? You definitely got you always have to worry about exit seeking. I know there's a caregiver there, but, we all know that, any form of dementia is a progressive disease, and things can change overnight with an individual. Is she going to walk out the door? Is that? The other thing, you've got a caregiver there. That's great. And then, of course, you also have to always worry about caregiver, if she's at home, caregiver burnout, etc. So there's a lot of great things about memory cares. They do a lot of mind stimulation, and they keep people really engaged, et cetera, et cetera. So, but I know it's a big choice, and she's on a journey just like you are, and I'm glad that she has you to help her.
Thank you. Yeah, my biggest concern right now is the caregiver is going to be moving out. And so while I do have cameras and everything like that, I cannot be there 24/7. So I do want to get in touch with someone to assist in the qualification process to help me do that.
And she's not on Altex right now, correct?
No, she's not.
Okay, gotcha.
Thank you.
All right. Okay, very good.
Thank you.
Thanks, David and Marlene, for answering Tracy's questions. Just to follow up on something that Tracy said, if she could ask follow-up questions, please ask follow-up questions. Please do not feel like you can only ask one question. All right, Colleen has a question, and then Brian Johnson has a question in chat. We'll do Colleen and then Brian.
Hi, this is for Zach. I just wanted to know, if someone calls you, how do you assess their home if they want to age in place? And not go into a facility or anything like that, if they're not ready for that? What do you do? What are your first steps that you take?
Great question. Nice to meet you, at least virtually here. So any home care company should be able to provide a in-home complimentary assessment. which assesses both the patient and the living environment itself. We look for a lot of things like fall risk, adaptive equipment, grab bars, retractable wands for shower chair, things of that nature. Fall risks like chairs that have wheels on them, rugs that you can slip on, hoarding situations, cleanliness. So you do a full assessment, room to room, and as well as with the patient as well, to see how what their abilities are at the current state, and how how practical is it to stay at home long term, right? And we'll go over all of that with the family and with the patient in home. Again, complimentary. And then if it does seem like there is a need to move into a more secure community, we'd work with people like David to do supplemental care in the home until that time does come where you find the right place to move them. But any home care company you work with should come out, do that assessment. And part of that assessment is also reviewing the policies and procedures of the home care company, and what kind of care they're going to be providing you.
And Zach, I have one more question. What are the worst things that people like in their homes, like for falls? What have you seen that that are the most risks for a person in their home?
Well, quite frankly, the biggest risk is the patient themselves, right? If they're shuffling, what kind of conditions they're dealing with, if it's stroke, Parkinson's, bad gait, things of that nature. That is the biggest risk, is the patient themselves. But what areas of the house you typically see the most falls are kitchen and bathroom, because you have water. That's it goes to the same bathroom, especially. You got the shower and a sink that's being used pretty consistently. One of the things that scares me is when you have these granite or similar like countertops, and you don't have a grab bar, and seniors, are just people in general really, but seniors are using that as a grab bar to push off of. You can't see liquid on there, and you can slip. Throw the rugs, the mats to step on something warm coming out of a shower or by the toilet. A lot of those crumple real easily and shift. If your weight shifts, you're going to slide on those and fall. So the majority of our falls that we see are bathrooms or kitchens, but also thresholds going outside, which in Arizona is a very big risk, considering with 6 months of the year, 7 months of the year even, you can get third-degree burns just laying out on pavement for 10, 15 minutes, right? So if you have high thresholds going in and out of a garage, onto a patio, out of a front door, a trip and a fall there where you're alone and you can't get you're screaming and you can't get anyone to help because you're by yourself. You're just screaming for help and hope a passerby comes by. A very, very dangerous situation for those folks. But the patient is the biggest fall risk. And then some of those other things I talked about.
Thank you.
Yeah.
Thanks, Colleen and Zach. Zach, I believe we have another question for you in the chat for Brian. And then Brian's second question, I believe, is for Lamar. The first question is, are there certain questions or criteria I should consider when hiring a caregiver for a loved one? I see so many ads on websites and it's hard to figure out who is good and who isn't. Thanks.
Yes, Arizona. I'm actually is this in the chat you said?
Yes, it is. It's Brian Johnson's first question.
Okay, I'm gonna type in something right here as we're. Okay, so that website I just chatted in for everybody. There are questions to ask for consumers. So Arizona In-Home Care Association is an association. It's a consumer advocacy and business trade association for best practices and safe delivery of care. The reason why it's so important is because Arizona is a non-licensed, unregulated state. So you don't really know who you're going to get. Home care is a huge industry with very little oversight, and in Arizona, virtually no oversight. The only oversight that does come into play is some of your Medicaid providers. They have rules to collect their Medicaid, but with home care in general, there's no oversight whatsoever. So as a consumer, if you hear a flashy ad or meet a nice person, they could be selling you a bill of goods. The best way to protect yourself is to go to the website that I just typed in there, asnaha.org. They have questions for consumers to ask so you know what you're getting. There's also a state law that it doesn't have a ton of teeth because the state's not really policing it, but there is a state law, statute 36144 for home care, the only law on the books for home care, where we do have to disclose certain things to a consumer before providing care. The law doesn't really state descriptively like how you describe those things to a consumer, but best practice is to have it in writing and have the patient sign off on it. The way you can protect yourself is to make sure those questions are answered. Go on the website and use that cheat sheet as well to ask your questions when shopping for a proper home care company. One of the biggest things I can tell you is there's a huge just difference between W-2 and contractor. That is a question you should ask. It's not whether or not your employees are, well, the question is whether or not your caregivers are employees, right? We have had incidents where a company will have contractors going out to provide care, and then falsely advertise saying that their employees are bonded and insured, which is talking about their office staff, which is not something necessarily a consumer cares all that much about. They're more concerned about who's coming in the home and whether or not you're protected from those entities coming in the home. But even through ASNA, there's over 100 choices in there of companies trying to do the best they can to mitigate any risk or exposure and deliver proper care. Like to the question earlier, every company in ASNA does those complimentary in-home assessments, and we'll go through a disclosure form with you so that you understand exactly what kind of care is being delivered in the home. So there is a ton of questions I could go over, but the best thing for this group, so I don't take up too much time, is for a consumer to go to that website, and you'll have a great cheat sheet when you start your journey.
Thank you, Zach, for that resource. And then Lamar, Brian has another question for you. I'll type it again in the chat. It is, if someone is a winter visitor from another state, will my Medicare Advantage plan cover me here, or should I consider getting into another plan like Medicare and a supplement plan? I think you might be muted, Lamar.
Yep, I'm that guy. I was the one talking while it was muted. So, anyways, that's a great question, though, because a lot of seniors do travel. And so they're in different parts of the United States at different times of the year. So it's important to always check. Most Advantage plans have a national network. And so they will work in other states, but not all. So you need to be sure for sure that you do have coverage in that state you're going to be at. I'm always a big proponent of PPOs. Because then you'll have out-of-network coverage. So then no matter what, you don't have anything to worry about. And I could tell you some horror stories as to why I don't like HMOs at all. I had a gentleman 3 years ago on the 4th of July. He was walking on the sidewalk, and there was a person who hit him on the sidewalk with their car. And they weren't under the influence of alcohol, but they were of drugs. And so HMOs are supposed to cover medical emergencies if it's life-threatening. Okay, this gentleman had a Blue Cross Blue Shield HMO plan, and it took 2 years to get that claim paid because they took him to the nearest hospital, which was not in network. So if you want to be sure that your Medicare Advantage plan provides coverage for you, I always tell people get a PPO. I'm a huge proponent of PPOs. If you do have a supplement plan, that's where I was telling you, it's the Cadillac. You can go to any doctor in any state. So if that's something that's a big deal to you, then I would definitely recommend a supplement plan in those situations. But many of the carriers, like your Blue Cross Blue Shield, your United Healthcare, your Humana, they have national networks, but you've got some private fee-for-service plans out there that are not national. You've got some other Advantage plan types that will not work in every state. So it's definitely something you want to call your carrier and ask questions about, or if you have an agent, call your agent and they can help you out.
Thanks so much, Lamar. There's another question in the chat from Colleen for Marlene. What do you suggest a person do to protect their assets so nothing goes through probate?
Okay, good question. It's not this isn't really going to pertain too much to long-term care, although there are provisions you can insert for long-term care and protection of assets. But if you're really concerned about probate, typically your revocable living trust is going to be what will work for most people in the US. That's because revocable living trust will avoid probate if your assets are titled correctly to the trust, but it also gives you, as what we call the trustor or the grantor, the person who owns the assets, it gives you the most control over your assets going forward. It doesn't cause immediate taxation or assets to leave your estate. It gives you some good tax benefits. It gives you great control over assets, just better than a typical will would do, so that as assets at your death flow to the next generation or whoever your beneficiaries are, then you've got the ability to say what happens after death. You have the ability to take into consideration your beneficiaries' conditions, and at the same time you avoid probate. The big concern with doing a trust is that you actually title assets to the trust, or you make the trust the beneficiary of your assets. So there's a little bit of homework to do when you do a trust, but it's readily available, it's easy to implement, and it's an excellent way to avoid probate.
Thanks so much, Marlene. We received a question ahead of time. I believe this is for Trey. It is, what is the actual difference between home health and hospice? Hospice scares me. What do you tell people who think it means giving up? That's what it means to me. And that is also in the chat.
Sure. Yeah, that's a great question. And that, there's no great answer there. Hospice is a tough choice a lot of time for families or patients. You know, I try to say shouldn't think of it necessarily as given up, because you're actually by electing hospice, we should be thinking of hospice as a Medicare benefit, because that's what it is. It's a service that's covered 100% by Medicare, and it's a service that seniors should utilize if they need it. So I guess something I want to touch on there is, when you elect hospice, you're not necessarily giving up, because there's going to be a hospice medical director. That's going to be a physician, and that between the hospice team and that physician, they're going to determine what are you going on to hospice for. So the classic example would be, maybe someone has a cancer and it's terminal, and the oncologist has said there's no more treatment to be done here. So the hospice physician is going to say, okay, we're going to do hospice, and we're going to manage this cancer. We're not going to treat it or cure it, but we're going to manage it. That individual can still see doctors that have nothing to do with the cancer. So it's you're not necessarily giving up all medical care and all treatment. But what you're going to do is, for that condition, let's say that cancer, you're going to let the hospice team and the hospice physician manage that problem instead of an oncologist or a specialist. And then outside of that condition, you can still see other doctors for an unrelated condition. So I can understand why, you might think you're giving up there, but that's really why, it shouldn't be something you just sign up for quickly, I should say. There should be extensive conversation between your primary care doctor, the hospice physician, even before you sign on to service, the hospice team. The hospice team's likely going to have some kind of community liaison that should be sitting down with you and explaining all of this before you sign any kind of papers. Absolutely recommend doing that. And the person that's electing hospice should be confident that that's the level of care that they want. And again, it shouldn't be an overnight decision. You should consult multiple parties, consult family, consult your doctors, consult the hospice team, maybe even interview a couple different hospices. I think Zach brought up a great point that, there are a lot of organizations out there that are not necessarily following the rules, or may not be adhering to the guidelines that Medicare and the state have put into place. So The CMS website, cms.gov, has a lookup tool for home health and hospice agencies. And you can type in any agency name in there, and it will pull up their public star rating. Medicare publishes a star rating, and it will publish the patient surveys. So anybody on home health or hospice will get a survey from Medicare sent to the family, like basically how well did that company do? And all of that is public and on the CMS website. So that's an easy way to vet whether you're going with a good organization. Hopefully that answers the question there. But I think what it really comes down to is it's something that should be considered over, several days, maybe. Don't jump into it quickly. Consult all the different parties, really make sure that's the service you want to go with. The hospice team, whoever you're going with, should be educating you on all these things before you sign any papers. And then, by the time you do sign those papers, sign up, you should feel confident that hospice is the service that you want. And it really is a good service for those who need it. You get medical care at home. They can bring equipment in the home. They can bring a CNA into the home to do bathing. You have access to that hospice physician if any problems come up, and you can treat a lot of those problems at home, like we've said, age in place, instead of having to go to doctor 1, 2, 3, 4, hospital, emergency room, all of those things.
Thank you so much, Trey. Tracy had a question, and then Troy in the chat, and then we'll go to Colleen. Tracy, if you'd like to go.
Trey, this question is for you as well. Mom was seeing a neurologist along with a primary care, and they determined she needed some physical therapy for her gait and all of that, walking properly at home. And so with her insurance, I was trying to find home health care. One company that was suggested didn't take her insurance. Her insurance sent me a list, one of which was, I think it was Hospice of the West, but it said home health care. So when I called them, they said, sure, we can come out. And obviously they thought it was hospice. And I was like, no, we don't need hospice. We're looking for home health care for physical therapy. And the gal ended up saying, I agree, you don't need hospice, but we would be happy to follow her along with palliative care. And that is just an extension or a sister partner with hospice. And it's been fine. They haven't done anything except for they sent a nurse out, and she did Mom's vitals and did all of that. We've got the physical therapist in place. But I wonder, is that something that I have signed up for that maybe I don't need, or is it fine to have, or what's your thoughts on that palliative?
Yeah, great question. So palliative is this middle territory, I like to say, and it's essentially for someone who's thinking about hospice, but they're not ready to sign up just yet. So it's essentially a you might say a watch list or a program where essentially that hospice provider might have your name on a list, and they're calling in to check in every month or so is typically what we see. Like, hey, are you ready to sign up for hospice now? Has there been a decline? Has there been another hospitalization, a new diagnosis to where you'd want to sign up for hospice? That's what the vast majority of palliative care programs are in Arizona. They're essentially just going to check in with you each month and ask if you're ready to sign up to hospice.
Okay.
Yeah. It sounds like what she needed was the home physical therapy.
Yes.
So as long as that's going well, that's great. And then I would say if you would want to be on a palliative care program if you are getting ready to move towards hospice care. If that's not in the cards anytime soon, there's really no reason to be in a palliative care program.
Okay, great. Thank you.
Yeah.
Thanks so much. There is a question in the chat for David from Troy. I'll post it again. For David, what are additional out-of-pocket costs in assisted living community / care homes aside from rent and care?
Okay, very good question. So we go to an assisted living, you have to buy David a Lamborghini. I'm just kidding. Okay, so if you go to a bigger assisted living, what's going to be included in that? And that's like a larger community of 50 plus people. What is going to be included in that is going to be your rent. It's going to be your base rent, I should say. And then if you have any care costs, they make a lot of money off of the care costs, and they add that onto the rent. So care costs would be additional. Your utilities, cable TV, transportation is all covered. Out of pocket would be if incontinence supplies are involved, you have to pay for those. Haircuts, nails, most of those places have salons, etc. Um, and again, they have transportation, and they have usually it's about a 15-mile radius, then they charge you some more per mile over that. um, and all your meals, all your snacks, etc. That's all included as well. If you go to the smaller assisted living group homes, which usually are going to be licensed for 10 beds or less, although some of them are up to, coming up to 15, 16. It just depends on the group home. Typically, if you go into an assisted living home, one of the perks of that is you can usually negotiate something that might be better suited for a person's finances. So you could go in and say, my monthly rent is $5,000. And in that 5,000, that includes all the care. They're not going to add costs on, et cetera. But typically in the smaller assisted living homes, some of them will make they'll cover incontinence supplies. Some of them will not. It depends on the home. Usually, most of them do not have transportation, so that would have to be out of pocket. More and more of them are getting their own vans and stuff. But other than that, your group homes are going to be the smaller homes. They're going to cover, your laundry, your cleaning. They're going to pretty much include everything. So for a lot of people, you get a better deal regarding finances. And again, there's an appropriate time and place for a group home as well, regarding activities of daily living and cognition, et cetera. But that's pretty much it.
Thanks so much, David. I think there's a follow-up question from Tracy in the chat. What is a typical fee that companies charge to have help with qualifying mom to ALTCS? And I will put that again.
Oh, I can speak to that. I don't really know if there's a typical fee. There are attorneys that help with qualification. There are non-attorneys that help with qualification. If you're looking for, I can tell you what it involves, and that's why the fee varies. It is going to involve interviews with family members. It's going to involve understanding a person's medical condition. It's also going to involve record keeping. And so when you apply for Altex, the person has to produce all kinds of personal records, financial records. And so what it will hinge on is the amount of research that needs to be done, the amount of records that need to be compiled. If you're looking at strategies that might go out months or years, even to enable a person to be qualified, and you're looking at anything complex, it's going to actually cost more. I would say just a ballpark figure for someone who already has spent down most of their resources and they're looking at, now I'm running out of money literally and I need to get some care. You're looking probably at a $4,000 to $5,000 fee to begin with because of the paperwork involved and the verifications that go along with it. But I'm not going to really say that there is a super typical fee. It's just going to depend on where the person is and how much time they have and what paperwork is involved. Sorry, couldn't do better.
Thank you so much. As we are wrapping up, you guys, we want to thank everybody for joining, all the panelists and all the participants. If another question does come to mind, you can reach out to the panelists directly. You are going to receive a follow-up email with each panelist contact info and a flyer kind of summarizing their services. Our next webinar is July 7th. We would love to see you there. That is 10 a.m. Mountain Standard Time. Yes, correct. Thanks everybody for coming. We hope you have
Thank
a
you. You
You're
did
great,
awesome.
Grace. And thanks, everybody.
Thank you, everybody. Have a wonderful day.
Bye. Bye.